Hello, it's 9 p.m. in RTD. It's time to English New Edition for tonight headlines. We have the visit of the Minister of Health of the Saudi Medical Mission. For the international scene, the referendum of independence will take place on Sunday in New Caledonia. Welcome to our newsroom. The message of congratulations from the President of the Republic to the new German Chancellor, the President of the Republic, His Excellency Ismail Omar Guelleh, wished success and achievement to the new German Chancellor Olaf Scholz, elected today by the Parliament of his country. I hope that the friendly German nations will increase under your leadership its prosperity and influence on the international scene. President Guelleh wrote in a congratulatory telegram and addressed it to Mr. Scholz. Your important political experience will undoubtedly be a valuable asset in defining new niches of fruitful exploitations for your country and your people. The head of state also noted in the same document the Republic of Djibouti is pleased with the continuous development of its relations of friendship and exchange with the Federal Republic of Germany, said the President of the Republic, who also took advantage of his telegram to reiterate to the new German Chancellor his willingness to work to strengthen these already privileged ties. Leaders of the Social Party SPD, which came out on top in the last legislative elections, 2.5 months ago. Mr. Olaf Scholz is a well-known landscape of his country. Prior to his election as a head of the German government, he was both vice chancellor and minister of finance. The Minister of Health, Dr. Ahmed Roble Abdillah, accompanied by executive of his ministerial department, went this morning to the General Hospital Peltier to see closely the progress of the medical caravan cardiopathy of children carried out since yesterday by the Saudi medical missions of the King Salman Center for Humanitarian Access on Relief, second in its kind. This step is part of the fraternal relations and fruitful cooperation that exists between the Republic of Djibouti and the Kingdom of Saudi Arabia, especially in the field of health. On his arrival, the minister was welcomed by the technical director of the General Hospital Peltier, Dr. Saeed Aouled, surrounded by his closest collaborator. During this visit, the Minister of Health closely followed the surgical operations performed by the medical missions, which includes many cardiologists. So far, the missions has performed heart surgery for 8 children. The Minister of National Education Vocational Training, Mustafa Mohammed Mahamoud, is participating in the World's Innovation Summit for Education WISE 2021, which takes place in Doha, Qatar, from December 7 to 9, under the theme Activating the Generation, Reclaiming Our Future Through Education. He is accompanied by the Inspector General, Ms. Muna Ismail Abdou, the Dean of the Inspectors, Mr. Abdul Qadir Dahir Aden, and the Head of Communication Department, Hussein Abdullahi Merone. During his visit, he was received by His Excellency the Ambassador of Djibouti in Qatar, Mr. Daif Dubad Roble, who participated with him in this World Summit, considered among the most important and able to shape the future of education. WISE is an initiative of the Qatar Foundation, whose president is Her Highness Sheikh Hamouza bint Nasser. It is organized every 2 years and brings together thousands of education stakeholders and innovators from around the world to share their expertise and know-how, both face-to-face and online. The Minister of National Education Vocational Training, Mustafa Mohammed Mahmoud, participated on Wednesday, December 8, in the ministerial roundtable on the theme of the zero students out of school. This meeting was held on the sidelines of the WISE 2021 World's Innovative Summit for Education in Doha, Qatar. The roundtables was co-hosted by Mr. Fahad Al-Sulaisi, CEO of the Education Above All Foundation, who gave the welcoming remarks on Dr. Marie Joy Pigozi, Executive Directors of the Foundation. In addition to the Djibouti ministers, the roundtable was attended by Ms. Claudia Cole, Minister of Primary Education of the Gambia, and Simei Mohammed Saeed, the Minister of Education and Vocational Training of Zanzibar. The bilateral cross-border meeting between Djibouti and the Federal Democratic Republic of Ethiopia to launch a governance structures for harmonized disease surveillance and immunization took place yesterday at Sheraton Hotel. This meeting is chaired by the Secretary General of the Ministry of Agriculture, Mr. Ibrahim Elmi, and was attended by the Minister of State for Agriculture and CVO of Ethiopia, Dr. Fikru Rigasa. The objective is to make a coordinated control of transboundary animal diseases such as PPR, foot and mouth disease, and other diseases that have a negative impact on the livelihood, health, welfare of millions of livestock owners and on trade to Middle Eastern and African countries. Therefore, there is a need to strengthen the collaborations at the border and the operational signed memorandums of understanding for effective and harmonized control and prevention of disease along the borders. The meeting was attended by the directors of agriculture of the region of Tajura, Dakhil, and Ali Sabia, but also the representative of the agriculture at the level of Afar and Somali region of Ethiopia. And now listen to the Ethiopian Minister of Agriculture, Dr. Fikru Rigasa.
It's a great honor and pleasure to take part on this vital bilateral meeting for the sister countries, which will be basically dedicated to review the already developed cross-border animal health implementation framework based on the signed memorandum of understanding between Federal Democratic Republic of Ethiopia and the Republic of Djibouti at Ras Hotel between the 19th and 21st December 2018 in Redwa, Ethiopia, for control of transboundary animal diseases and sanitary measures. Taking this opportunity, I would like to thank ICPAD for leading and vital role played in facilitating that historic event. As you know, Ethiopia is currently in a state of renewing and refocusing its diplomatic relation with all its neighboring countries, including the Republic of Djibouti. Ethiopia is working collaboratively with Djibouti in terms of economic, political, social, and other aspects. As one of the economic and social relationship, the cross-border collaborative work to control and prevent livestock disease by implementing the strategies contained in the memorandum of understanding is the one to mention. Coupled to other issues, we have a strong and special relationship with the Republic of Djibouti, taking into account the crucial importance of the port of Djibouti for export of goods from Ethiopia and import of goods from countries of origin to Ethiopia. The fact that the two countries share borders, there are movement of human and animals between the two countries due to either to search for pasture and water during droughts or for trade.
The Secretary General of the Ministry of Agriculture, Ibrahim Elmi, has indicated that the objective is to make a coordinated control of transboundary animal disease such as PPR, foot and mouth disease, and other diseases that have a negative impact on the livelihoods, health, welfare of millions of livestock owners and on trade to Middle Eastern and African countries. Therefore, there is a need to strengthen the collaborations at the borders and the operations of the signed memorandums of understanding for effective and harmonized control and prevention of disease along the borders. Today, Wednesday, December 8, was held at the National Assembly a consultation meeting between the Parliamentary Group for Population and Development of Djibouti, GPPD, and the representative of the APDA, Asian Population and Development Associations from Japan, and the representative of UNFPA, ASPD came from Cairo to participate in this very important meeting. The representative of the Arab Parliamentary Forum from Jordan is also participate in this meeting by video conference. The discussion is focused on the activities and role of parliamentarian in the interrelationship between the population issue and the goals of the 2013 Agenda for Sustainable Development at the Nairobi Summit of ICPD 25 in 2019. Strong commitments were made by the leaders of all countries and for sustainable development by our country.
The unfinished agenda and to tackle main emerging issues at the region as gender-based violence, maternal and child health, reproductive health and population issues, and the main objective is the human rights, how to get ICPD people-centered. Since we, ABDA, FABD, and UNFPA are presented today to discuss the support on developing the law on protection of maternal and child health, UNFPA ASRO has developed a regional strategy on the health of women, girls, and child, covering the period from 2019 to 2030. This strategy mainly to align with the SDGs and ICPD program of action. The main objective of this strategy is to support all country offices at the legalization level to protect the maternal and child health.
The Member of Parliament and the President of GPPD, Umar Hassan Mohammed, has indicated in the discussion that the discussion is focused on the activities and role of parliamentarian in the interrelationship between population issues and the goals of the 2013 Agenda for Sustainable Development. On Tuesday, December 7, 2021, His Excellency Abdul Qadir Hussein Omar handed over to the Crown Prince of the State of Kuwait, His Highness Sheikh Michel Al-Ahmed Al-Jaber Al-Sabah, his credentials in his capacity as Ambassador Extraordinary and Plenipotentiary of the Republic of Djibouti to the State of Kuwait. During this audience, the Ambassador conveyed the Crown Prince and threw him to the Emir of State of Kuwait, His Highness Sheikh Nawaf Al-Ahmed Al-Jaber Al-Sabah, the warm fraternal greetings of the President of the Republic, Ismail Omar Guelleh. The Ambassador praised the excellent relations, the solidarity, cooperation that unite the two countries. He also expresses his willingness and determination to work further to strengthen these privileged ties existing between the two countries. Under the high patronage of the Ministry of Justice and Prison Affairs in charge of Human Rights, the Secretary of State in charge of Sports, in the partnership with UNFPA, organized this Wednesday, December 8, 2021, a ceremony of official handing over of materials and sports equipment at the Central Prison of Gabod, as well as the inauguration of a friendly space for women and adolescents. The materials handed over were composed of sportswear, balls, table soccer, keys, other boards, games, as well as fitness equipment. A room equipped with a television and air conditioners was also put at the disposal of the prisoners. The ceremony, colorful and emotional, was attended by several personalities from the SES, MFF, and UNFPA, CNDH, the Central Prisons of Djibouti, Gabon, and several presidents of the Sports Federation. The Djibouti Evaluation Association is organized on Tuesday, December 7, the second edition of the Cycle 4 conference debate that it intends to reproduce quarterly thanks to the support and its partner and entitled Le Rencontre des ADE. This second edition took place in the conference room of the Institute of Diplomatic Studies from 9 a.m. to 12 p.m. with the live broadcasting of the speaker in order to allow the greatest numbers of people to follow the debate from a distance in this period of pandemic. The theme chosen for this occasion, namely impact assessment in the field of employment policy and capacity building programs for state agents, was presented by two eminent experts, Professor Sharmaki Idris, Director General of the INAP, and Dr. Hassan Abdi, State Inspector. For the second consecutive week, the Ministry of Health through the National Institute of Public Health of Djibouti continues the campaign of special spraying, which aims to eliminate mosquitoes and other harmful insects. In this context, the mobile team of the National Institute of Public Health has implemented the campaign in several neighborhoods, including in the municipality of Balbala and Bulaos. It should be noted that the spraying operations are mainly targeted in areas where malaria is prevalent and undoubtedly contributes significantly to reducing the spread of malaria. As part of the holding of meetings to review the mandate of local elected officials in the region of Dakhil, the Regional Council of Dakhil organized yesterday, Tuesday, December 7, a first meeting with the general public of the region of Dakhil with the purpose of presentations of assessment and report of mandate 2017 and 2021. In addition to the local elected officials took part in this meeting, a large number of participants, including the Deputy Prefect, the executive of the deconcentrated services operating in the representatives of the United Nations agency residing in the region, civil society organizations, traditional leader, women and youth of the regions of Dakhil. The objective of this meeting is on the one hand to present to the population of the Dakhil regions the report of the 2017-2021 mandate, and also to share with the community to which they are accountable the strengths and weaknesses as well as the opportunities and threats of the achievements undertaken during this past mandate. For the international scene, the Council of State has rejected the request of citizens group to postpone the referendum on independence scheduled for December 12 in New Caledonia, ruling that the health context was not an obstacle to the conduct of the vote. The Council of State has also rejected the arguments of respect of the Kanaka mournings and customary practices, judging that these circumstances could not characterize by itself an infringement of fundamental freedom likely to justify a postponement of the referendum. The applicants, 146 voters, mostly Kanaka, and 3 associations, according to one of their lawyers, had also argued that up to 2,000 voters of the commune of Belep, the Isle of Pins, and the Loyalty Island had not been able to register in the decentralized polling stations in Numia. This is it for the news. Thanks for watching us. Have a good evening.